Hello everyone. I work for the estates team for Cornwall Partnership NHS Foundation Trust. I'm just going to share my screen. Hopefully this will work. Can everybody hear me all right?
Yeah, all good.
Okay.
And I've got your slides here. So Alan is the carbon king.
Well, I'm not sure I describe myself in that way, but thank you. Yeah, so can you all see that? Is that okay? Yeah, so I'm just going to try and give a bit of an update today on what we've been doing in estates from Cornwall Partnership NHS Foundation Trust perspective. In relation to the Green Plan, which was ratified by 3 boards, the Integrated Care System, in March of this year. Let's try. Oh, that's not moved on, is it?
No, it hasn't. So just give it another whack and just see if it works.
Percussive maintenance. There we go.
There you go. Yeah, percussive maintenance, that's the one.
Yeah, it'll probably skip on about 3 times now, won't it? Anyway, so this is just a bit of an overview of my presentation. So it's broken down to 4 chunks, where we've come from, what we're doing, and where I think we need to get to, and some questions at the end if we've got time. So in terms of where we've come from, a bit of context, and apologies if some of you are already aware of this, but just to recap, we produced our Sustainable Development Management Plan in 2012, had a 15% energy reduction target. By 2015, we achieved a 62% reduction. Very aware that's just energy, so that's just a small part of the picture. And then in 2016, we revised recast our Sustainable Development Management Plan, and it had a new target of 28% reduction in carbon emissions by 2020. And we achieved that target across most of the reportable areas, so energy, water, waste, pool, lease car areas. So what's happened over the last year or so is that terminology's changed in terms of national guidance to a green plan. And in the NHS standard contract, again, a lot of you will be aware of this, all NHS providers should have a green plan. So in summer of last year, we commenced work on an integrated care system level green plan with our partners as shown here. That was the Clinical Commissioning Group and Royal Cornwall Hospitals NHS Trust. And quite helpfully, in October last year, NHS England and Improvement produced a document called Delivering a Net Zero NHS. And I think most of you will be aware of this as well, but the key targets in that document are net zero carbon footprint by 2040 and net zero carbon footprint plus by 2045. And quite helpfully, they break that down into this slide here, which shows the scope 1, 2, 3 greenhouse gas emissions, and what that means in terms of the NHS carbon footprint and NHS carbon footprint plus. So what we're doing at the moment, so we commenced, as I say, work on the Integrated Care System Green Plan in the summer of 2020. The Green Plan was ratified by all 3 partners in March of this year. Our targets are net zero carbon footprint by 2030 and a net zero carbon footprint plus by 2045. So as you'll see, that's a much more ambitious target in terms of carbon footprint compared to what's set out in the NHSE/I net zero document. Our green plan is broken down into 10 focus areas. I'm not going to read all those out there. What I want to talk about today really is number 2 there, asset management and utilities, which is predominantly estates related activity. So this is an extract from our green plan. It shows all of the partners' carbon footprint. So that's RCHT, CFT, and the KCCG. All you'll see on the left-hand side there's a carbon footprint label. Along the bottom, all the priority areas to reach net zero carbon footprint by 2030. And I've just sketched on there what the estate's priorities are within that. So you might not be able to see those, so I'll read those 4 out. 100% renewable electricity, renewable heat networks, optimizing building usage, and upgrading our buildings to zero carbon standard. So those are really, from an estate's perspective, our 4 initial priorities. So in terms of updates on those, well, again, you know, estates are a major contributor to the carbon footprint as per the previous slide. We manage 161 individual electricity, gas and water supplies across Cornwall and the Isles of Scilly. And in relation to that, in 2021, we reduced our energy and water carbon emissions by about 8%. But I'm not afraid to admit that some of that will be down to COVID-19 and the restrictions that were in place over the last 18 months or so. So there is an element of, COVID-19 has helped to achieve that 8% target, reduction. Again, back to the 4 key areas in the Green Plan, priorities for the estates team. In April this year, we signed up to 100% renewable energy guarantee of origin electricity. So that's 59 of our energy supplies that are now 100% renewable electricity. And in August of this year, we applied to the Low Carbon Skills Fund for a grant of £98,000 to produce a heat decarbonisation plan. And the reason I mention that is because it is linked to those 4 priorities within the the estate's priorities in a carbon footprint for net zero by 2030. So what it actually means is we are at this moment surveying about 50% of our occupied estate. So that's about 47,000 square meters. So in context, domestic residential properties, roughly about 100 square meters. So it gives you about a scale of what we're surveying at the moment. That commenced in October of this year. We hope that the heat decarbonisation plan will be approved by February of next year. So the key thing that it's likely to recommend, which is again ties to those priorities in the estate's priorities that I alluded to earlier, is it's likely to recommend moving away from burning gas and oil and moving towards installing ground source heat pumps, air source heat pumps, and installing more solar PV and PV systems. Better utilisation of the systems we have in place at the moment. So, for example, some of the solar PV systems we've got at the moment, we could reconfigure those to preheat some of our hot water. And at the moment, we at the weekends we're not benefiting from some of the electricity that's generated by those systems. So we need to look at that. Optimizing our building management systems and similarly our ventilation and air conditioning systems. Another recommendation is likely to be upgrading the usual things in terms of improving the building envelope. So that's upgrading insulation, controls, plant rooms, and reviewing use of areas as well. So the overall aim of that is to have a costed plan with the risks, dependencies, timescales, and et cetera, outlined. So then we're well positioned then for future funding streams, such as the public sector decarbonisation scheme. You've probably all seen of that. It's in its 3rd tranche at the moment. And also it's got co-benefits of assisting us with energy supply and cost resilience. And again, you'll have seen all of that in the media over the last 6 months in terms of where the energy market is going at the moment. If we can install additional renewable heat networks and renewable energy systems, it's only going to be good for us in terms of resilience and continuity of supply.
Alan, can I ask you a very quick question there, just while I'm ahead? One is, are any of those funding schemes available to smaller premises that aren't part of the NHS proper, like doctor surgeries? This is my first one. What are you doing with the excess energy that you might not be using, for example, from solar PV or solar thermal over the weekend at the moment? Is it going back into the system, or is there an opportunity to do it somewhere else?
So we've got a 40 kilowatt solar PV system at Trevillis House in Liskeard. That was grant funded in 2014 through a DOH grant for a transport carbon reduction project. We can't benefit from the feed-in tariff from that system because you can't double dip with grant schemes. So what we're looking at there is to potentially utilise that. I don't think the technology is there at the moment. We've got electric vehicles on that site. So in my mind, if we had a system where there could be some kind of relay that would recharge the cars at the weekend from the solar PV system, brilliant. But we may need a standalone battery system to do that, and that's going to be quite expensive. But hopefully, through the heat decarbonisation plan work, and Trevillis House is one of those that's being surveyed at the moment, as are a number of NHS property services sites as well. Hopefully that will come through in that work, those kind of recommendations that we could put some battery storage in to utilise at peak times. reduce cost and improve our resilience. What was the first question? Sorry.
Well,
Oh,
it was
yeah,
for the,
people accessing.
yeah. So doctor
Yeah,
surgeries and practice is a completely different bit of the kit of
I
the
don't
care system.
think so. The Low Carbon Skills Fund scheme has closed, and that was, I don't think the other part. I'm not sure. I'll have to look at that if I'm honest.
It would be useful if you had access to any information like that, because I'm sure there are several practices here today, and I haven't come across any that have accessed really great funding to now enable them to do the same sort of thing. So it would be interesting. Anyway, sorry, don't let me stop you. Carry on as you were.
No, it's really useful because, yeah, it's what we struggle with is the capital funding. So what we're doing at the moment through the Low Carbon Skills Fund with this grant for the heat decarbonisation plan, it will stand us in good stead for these future iterations of things like the public, so the PSDS grant funding. What we found in the past when we applied to the PSDS was if you didn't have a heat decarbonisation plan in place, you're at the back of the queue, so to speak. So we need a fully costed plan with all the risks and dependencies and the timescale set out so that we get ourselves to the front of the queue. I know with the PSDS that you could apply if the schools could apply, but I'm not sure about GP practices, if I'm honest. I'd be surprised if they couldn't, but yeah, I'll have a look into it and drop you something back.
That would be great. Jim's saying that yeah, GPs do own their own practices largely.
Yeah.
There are some that rent from government buildings where this might be applicable. That's a good point. But also it'd be good to hear for GP surgeries to hear that basically if you're getting some ideas together now, that might help you facilitate anything that does come on stream rather than not having thought about it. It is tricky. It looks like Green NHS are aware of some of these different buildings that have got complicated ownerships and looking to see how they can support problem solve. So there is some work on that. So brilliant.
Well, we will probably have to address that at some point because the NHS Property Services buildings that we occupy, it's under a lease license agreement, and obviously we don't own the infrastructure, so there'll need to be some kind of decision as to whether we can access those types of grant schemes. But the thing is, I'd be very surprised if there's not a lot of more announcements and a lot more money available after COP26 and all of the announcements about the money that's going to be made available. There's got to be more funding streams that are going to come online and more money in the existing ones. I just don't see how they can't support people to do this.
Thank you. That's interesting. Don't let me stop you now because I don't want you to run out of time. I'll carry on.
It sounded like a Queen song. Don't stop me now. Anyway, other related estates activity. So we currently spend about £3.5 million a year on capital works to refurb our buildings. Obviously, there will be a large element of carbon reduction as part of those refurbishment programs. A lot of work on estate rationalisation. Are we in the best buildings, in the best places? And are there better places that we can be, so on and so forth. Automating things like water loggers. I've talked a lot about that in the past, but really important for us because if we can get them on our more supplies, then we've got day plus one data. We can look at an online system and see if the consumption's going out of range, pick up leaks a lot more quickly. We've got aging pipe work and systems right across our estate, across Cornwall and Isles of Scilly. So those kind of systems are really, really helpful to us instead of waiting for a bill once a month with an actual read on it and then deciding whether we've got a leak. Better control. We're implementing changes. So we're looking at how we reviewed how we turn the heating on and off and working closer with our service line leads to decide when heating and cooling should go on or off, not a blanket approach. October the 1st heating on, May the 1st off. It's got to be guided by the people on site who are best placed sometimes to inform us. Our transport team, they've done a lot of work in this area. So 84% of our pool cars are now ultra low emission vehicles. Salary sacrifice schemes, we've improved our choice of U11 zero emission vehicles, and we're reviewing our cycle to work scheme. And finally, our waste team have done a fantastic job over the last 18 months, despite significant COVID-19 related issues, to maintain that service and to keep things running. It's a critical part of our service. So I just thought I'd mention that there very quickly. Where we need to get to this. So this slide is an extract from our green plan and our net zero carbon footprint plus by 2045. So as you'll see here, you might not be able to read the writing, but the biggest chunk is commission services, procurement, and it's not going to be a surprise to most of you here. Roughly about 60% of the NHS England carbon footprint. Last slide. So I've just put in green there. Achieving net zero is more than managing buildings. As I just mentioned, commissioning procurement is a massive part of our carbon footprint. Again, preachers are converted here, I'm sure. Also, other priorities in that net zero carbon footprint plus slide: pharmaceuticals, medical equipment, business staff and patient transport, and a key one, embedding environmental sustainability into all of our activity. We talk about sustainable models of care. We need to be thinking about this right across the board in everything that we do. And finally, there, in terms of priorities at this point in time, adapting and being more resilient to the changes that are happening and are coming. How do we do that? Just very briefly, we need to move forward our actions across all of our 10 green plan focus areas. And the first step, I think, is appointing an operational sustainability lead. So that's somebody similar to me, but covering right across the organisation and looking at the priorities that I've listed above there in more detail and taking those forward, particularly commissioning, procurement, and pharmaceuticals and medical equipment. These are hotspot areas that have been outlined by formerly the NHS Sustainable Development Unit that we need to be. We've done some work on them, but we need to do a lot more on them. Collaborating and planning, securing the resources, not just finance, people as well, to actually do the doers as well on the ground. Linking it right up through the organisation. I don't want to use the analogy of top down, but you should be looking at a flat management structure, but we need to be working right across the service teams and so on and so forth, and outside of the organisation, and implementing those changes and continually reviewing to making sure that we're on course to achieve 2030 target, our 2030 target, and the 2045 target. Sorry, I do realise I talk quickly. That's just a fly through roughly what we've been up to.
Alan, and a massive task. Really brilliant to see what the other CFT specific priorities are there, but you've got a massive task across the whole estate. But I think there's lots there that anybody who's got any sort of estate can learn in terms of the process and in terms of the complexity. Complex as in relationships rather than complicated, but how it all fits together.
Just picking up on a couple of comments before I started. I think Ryan's got a really good point. Persistence. That's one thing I've learned in 10, 11 years working for the estates team. We've got to be persistent. We've got to lead by example. We've got to just keep going. And I completely agree. It's got to become second nature, like a health and safety approach. We don't undertake any work in the estates team without fully considering our risk assessment and method statements, where appropriate. And that's a matter of course. And actually, as Ryan said, sustainability needs to be considered in that kind of way.
Absolutely. Kath saying, yeah, be a mosquito. They can only swat you away so many times before they get stung.
They try.
Do you generally have a positive reception to what you're saying across the whole estate, or do you find that it's a bit pushing more uphillish?
No, I think we're really lucky, and I should have mentioned that in the presentation I meant to. We've got an exceptional exec lead in Tamsin Anderson, who you're going to hear from later on. She doesn't just talk the talk, but she walks the walk. And we're very lucky to have that people like Tamsin, that kind of leadership. And it's not just Tamsin; there's many other people throughout the organisation are leading by example. And if we can get this sustainability coordinator in post, it's somebody who's going to support those people and help to drive forward the changes that we need to implement.
That makes a big difference. I know that Saskia, who's just nipped out to her school run and will be back shortly, is trying to find her way to the people who are willing to rattle cages in a way. You can rattle cages in a very nice way, in a very engaging way, but this is about a sort of massive cultural shift. So yes, I completely agree with you about Tamsin. Has anybody got any practical questions that they'd like to put to Alan? about how he's managed to do all this?
I'm not done it on my own. It's teamwork.
Teamwork. Any sort of practical issues? Are any of the surgeries here implementing anything like this on their buildings? I think that's a no then.
We have solar panels, but I think we're about to change buildings. I don't know if I'm allowed to say that, Kath.
Okay.
Well, anyway, we are, and so hopefully that will be an all singing, all dancing, highly efficient building when it happens.
Interesting. Jim and Ryan, I think you were going to add something.
Yeah, we obviously looked to switch suppliers, but I don't think we've. Yeah, unfortunately, our building faces the wrong way for solar panels, so it might make us feel better, but I don't think it would generate very much. And I think, yeah, I think anything we could learn from Yalom would be really valued, and I'm sure if, through Kath's doing a great job sort of coordinating efforts for primary care, and linking in with you, where you've obviously thought about this for a long time, would be really valuable and helpful to us.
Yeah, very happy to help where I can. I think kind of a question back to you guys. So again, apologies, I'm not aware of the structure from your side of things. So do you, as a group of GPs, have some kind of forum where you can bounce ideas off each other? And are you working on a green plan for each surgery or across Cornwall, or how's that working?
Shall I step in there? Yeah, we have got a forum. We've got a sustainability group now, and we have representatives from each of the areas. And the idea is that ideas at practice level get fed up to the group, and ideas shared amongst the group get fed back down to practice level. It's very difficult, you've got some very small surgeries in old buildings, and we've got big, all singing, all dancing, really kind of environmentally friendly buildings. And I'll shoot Kavita later for spilling the secrets, but we're aiming for BREEAM excellent in our new build. I think Ryan will hopefully give us a bit of feedback, but we tried desperately to get a united bulk buy green tariff for all the practices, and it's been impossible. We tried to switch our energy supplier and got told that they couldn't do it. They couldn't even switch us onto their own green tariff because the costs were prohibitive. A lot of surgeries have got a fixed contract, and that's the way we have to manage our budgets. So yeah, there's lots of it's lovely hearing what's going on in CFT and RCHT, because it does have an impact on all of us. But in primary care, we really struggle when it comes to estates, really, in terms of reducing our carbon footprint. But I've just put in the chat, I think we need to remember that it's all very well switching to renewables, but we need to reduce our energy consumption as well. So, if you can't stick solar panels on your roof, Jim, go around and sticking stickers on everything, turn off the lights, turn off your computers, don't fill the kettle. It all adds up, doesn't it? And at least you're doing something, and it starts that conversation and it starts that thought process. So I think yeah, I banged my head a few times. I
think you're right there. The danger is if you sign up to a green tariff or you put in some renewable energy systems, it's almost like, oh, it's situation normal, we can carry on as normal. I'm not saying for 1 minute that everybody thinks in that way, but I think some people could. So we need to think about the energy hierarchy. It's not just about the energy hierarchy. We need to have a carbon hierarchy, don't we? But in energy terms, you look at the building envelope, then you look at the controls, and renewable energy is the last thing you should be looking at, really. And it's really good to hear that you're utilising the BREEAM assessment and using that. So yeah, it's positive.
I'm really sorry to hear that, Jim. It says, I've got a practice manager who doesn't put the heating on until my fingers are too cold to type. Gloves, mate.
Well, I feel your pain. So we've got a lot of buildings, and quite often we'll have somebody who says, can I have the heating on? Quite rightly so. That's fair enough at particular times of year. And then a week later or a day or two later, you get somebody in the same office going, oh, can you turn the heating off? So we've all got to remember we've got different thermostats within our bodies, so to speak.
I just put a shout out there for middle-aged women. Actually, we're very, very different. Just
I've,
get right out there.
I've almost come across with that in the past, so I'm
Yes.
very aware that I need to be very tactful with that.
Absolutely.
Just carbon efficient, Manda.
Just very carbon efficient. We are our own Battersea, aren't we? In so many ways. Obviously very green and low carbon. Maggie, you wanted to say something. I think in terms of the solar panels, Jim, I was going to say there's also the possibility of ground mounted if you can't use your roof. But yeah, it's definitely about reducing first and seeing what you can do. And sometimes, yeah, having a cheap supplier isn't a great idea in terms of reduction. Having a slightly more expensive one brings your reduction down as well. So
got to be really careful that at the moment. I think I had an update from one of the industry specialists this morning. I think we're potentially looking at about 40% of the current suppliers going out of business within the next year in total.
It is tricky.
So cheapest is not always the best. You've got to be really careful.
You would, and I would say as the last point, just before I bring Maggie in, is I'm just wondering if there's an opportunity here for practices to actually club together. I don't know if that's at all possible in any way in terms of any sort of procurement. There's lots of Community Energy Plus does a lot of work for a lot of households across Cornwall, and they've got all sorts of different energy clubs where people can club together and get a decent price. And I'm just wondering if there might be something comparable for it.
There's definitely frameworks out there that the GP practices can utilise, and I'm happy to help where needed. Yeah,
that's fantastic. Thank you, Alan. Brilliant. And Maggie, and then Ryan.
Hi, I just wanted to bring in the fact that hospital premises usually have quite a lot of grounds, and those grounds can actually be managed better for nature than they have been in the past, and we ought to be mindful of the ecological emergency as well. I have been with a woman called Melissa Ralph, who works for the Green Infrastructure for Growth in Cornwall Council, who also volunteers with us in Health and Climate Action Group. She has, as volunteer, been advising the groundswork team for the NHS Cornwall, and sort of advising where, for instance, in a place like Barncouth, we went to look at the grounds there and to see where more wildflowers could be grown, where more native trees might fit in. I just wanted to put a plea, and we've done the same at Helston Hospital. GP surgeries might have a little bit of ground that they could work on as well. And it's GP surgeries, I know from being a patient now, myself at St Kevin, you go there and the sparrows nesting in the bushes around the entrance. We all have to wait outside in a queue these days because of COVID. And you're really aware of it, or have been over the summer. So it's just something to remember, to try and do what we can for nature as well, if we have any sort of outside space that we're responsible for.
Massive scope for that. Sorry, is Maggie, is it? Yeah. Massive scope for that. I was involved in that project down at Helston Hospital. So it's the Helston Climate Action Group, isn't it? Which you've worked together to put some wildflower seeding in down there with NHS Property Services. I'm hopeful that's going to be a good trial that we could roll out to other sites if possible. Very aware that we've got, for all intents and purposes, monoculture type grounds where we've just got a tractor mower going around cutting the grass, and there are good reasons, if I'm honest, for that, because it's the cheapest, and I hate to say it, it's the cheapest and most straightforward way of managing it. But we need to be more actually in our green plan. We've got a big chunk there about innovation, so we need to look at how do we innovate. This shouldn't cost us more to do this. We should be able to set aside areas on, particularly Camberwell Redroof Hospital, as you mentioned. St Austell Hospital is another prime example with a lot of grounds up there that we could potentially do that. So yeah, bear with us. We're trying our best in that area.
That brilliant, Alan. And also Rupert's here, who's been working on the Stenac surgery tiny sensory garden. And I'm also thinking of the incredible edible stuff and how, in relation to the food stuff and Sarah's stuff and Trevobin and St Austell, there's no reason why we couldn't start planting fruit and nuts outside. That would be a really nice thing to do in terms of stuff that was low management. And didn't lot, but in actual fact might encourage people to come along and look after it a little bit because it's fabulous. So yeah, you can definitely leave. Well, yeah, there's a whole question there about outside management, but I think that's something we'd like to come back to. We haven't got the time for it now, but I think that's really important because it's better for carbon sequestration, better for aesthetics, better for people's well-being, staff and patients of a site, to see if we can use those bits of land more inventively.
Sorry, just very quick, I have to say we've got a new director who started with us in February of this year, and he's all over this. So, you know, these kind of ideas, it really feels invigorating. We've got somebody who's come in fresh from outside and is supportive on this whole agenda. So, yeah, feel free to fire the ideas across. We may not come back to you straight away, but you know, we'll certainly try and you know, as quickly as possible.